Okay, this second part is on nursing diagnosis. We've done our assessment, we collected our data, we clumped it together, and now we're making a conclusion about the data we have. Okay, so this is what we're going to do with the data. We're going to make diagnoses. And before we talk about nursing diagnoses, we need to talk about different types of diagnoses. Okay, and so one type of diagnosis is a medical diagnosis. I'm sure all of you have had a medical diagnosis sometime in your life. A medical diagnosis could be appendicitis, laryngitis, pink eye, um, the flu. These are medical problems that doctors or advanced practice nurses diagnose and they treat medically. Okay, a nursing diagnosis, on the other hand, we try to eliminate any medical terminologies and diagnoses in, excuse me, in the diagnosis of a nursing diagnosis. Formally, it is called a clinical judgment. It's a judgment concerning a human response. It's a response to what's wrong with you. So it's not actually the diagnosis, but how you respond to what's wrong with you. And that or a vulnerability that you might have for that response. And this includes a nursing diagnosis could be a diagnosis for an individual, a family, or a community. And the thing is, we are licensed and competent to treat, so we can do these independently. So nursing diagnoses are diagnoses that we use that we are going to be able to treat as a nurse under our license. And then we have something called collaborative problems. And these are problems that we work with other disciplines, such as maybe physical therapy, maybe speech therapy. Someone had a stroke, and we're working on getting them to be able to eat properly. We need the speech therapist to make sure the patient's not going to aspirate and to help with us. We might need occupational therapy and physical therapy to help with getting the meals, getting the strength and that. So we work together sometimes with other disciplines in order to solve a problem that we can't take care of on our own. Okay, and so the big thing is, as I told you, why do we use them? Why do we need to have them? This defines our practice. We can practice independently, and that it differentiates us from what a doctor does, what other professions do. It's a way to communicate what we're doing for the patient and pass it on to the next nurse in that. So, and we use it for guidelines so that we can give the best available care, the evidence-based practice that we have. Okay. So one side note is whenever you take your state boards and you try to get licensed for the nursing, you'll take something called the NCLEX exam. Instead of using the word diagnosis, they do use analysis in that. So they analyze a problem. But the nursing process is still using the word diagnosis. Okay. Where do we get these diagnoses? There's a whole list. They're created by an organization called North American Nursing Diagnosis Association, and it's international now. And so every couple years they get together, they look at the diagnoses, they take some away, they add some with input from registered nurses around the world on what we should include. Now, these are the only diagnoses that nurses are permitted to use, the approved ones, though there could be others. If you see that there's a different diagnosis and you think that it's important, you send it to the NANDA-I organization, and they will look at it and vote to see if they should be included with the next list. So there's a list in your book of all the ones that you are permitted to use. Okay, there are different types of problems and different types of diagnoses. So when we talk about nursing diagnoses, we're going to look at the types. One is problem focus. That means, oh, the patient has a problem already. It has developed, it is there. I see actual signs and symptoms of it. If I assess them, if I say they have a pressure ulcer, when I look at them, I see a pressure ulcer. Okay, and then I have to figure out to myself, though, when we look at that, what is causing that, but they have a problem. Another type of diagnosis is a risk. If I don't do anything, this patient very most likely can develop this problem. Like I talked about the pressure ulcer. They could be at risk for developing it. If they don't move and they stay in the same place for 24 hours without moving, their skin's going to break down because they haven't moved. And so they're at risk. If I don't do anything, they're going to develop that. So I want to prevent it. So that's a risk. Whenever you don't do something about it, that patient probably will develop a problem. We don't want that to happen. And then the other type is health promotion. This is when the patient is motivated and has a desire to be healthier, to be what we usually use for these is a readiness for enhanced, whether it's knowledge, whether it's coping, whatever you put in, but they're enhancing whatever they know. So that's health promotion. So 3 types. They have a problem. Another type is at risk. If they don't do anything, they will develop a problem. And the third type is health promotion. Let's make them healthier. They're ready to get healthier. Okay, so the thing is, how do I write a diagnosis? So we start with the diagnosis itself. Where do you find them? That's the list of NANDA eye diagnoses that you have. You have a whole list of over 200 of them that you can use. So you look at all the data and then you go through the list and see which diagnosis seems to fit. After we find the diagnosis, we want to know why they have that. If they're at risk or they have a impaired skin integrity because they have a pressure ulcer, I want to try to figure out why they have that. Because how can I prevent it if I don't know why? So I'm going to work with that. So the etiology factors is related to. And so very simply, I could say that this patient isn't moving. They have immobility. They can't move. So that's why it's causing it. They're not able to move, and so they're laying in the same place and they develop it. Okay, and then problem. If they have this problem, I know why they have this problem. And then what I'm going to do is, as a student, we require you to list the signs and symptoms you saw whenever you went through the list and decided that that was your diagnosis. So I would say they have an open area, stage 2 pressure ulcer, whatever you want to call it, on their coccyx. They're unable to move by themselves. Okay, so I could put things like that I saw that chose me to choose that diagnosis. Okay, and so then to write it, it's called a PES, problem. What is the problem? That's the nursing diagnostic label that you get from the list. E, etiology, that is related to. So what is it related to? It is related to immobility and signs and symptoms. They have stage 2 pressure ulcer on their coccyx. That's as evidenced by. So the full thing would be written: impaired skin integrity related to immobility as evidenced by a stage 2 pressure ulcer on the coccyx. We also have the risk type. And now the risk type it's a risk. They do not have the problem. So they will not have signs and symptoms of the problem. They have a risk, and you need to list all the risk factors, because by listing the risk factors is how you will be able to intervene. If they're at risk because of these reasons, we can intervene to stop the problem from occurring. So perhaps we say risks for impaired skin. And the reasons could be poor nutrition, immobility, incontinence of urine, whatever. I could put a whole list in that. And then that could be reasons why. So then when I do my interventions, I'm going to look at those risk factors and decide. So a problem focus, there's a problem, there's a reason they have it, and you will see actual signs and symptoms. A risk diagnosis means that if I don't do something, they're going to have it. So they're at risk for this problem, and these are the reasons why they're at risk for. And then the wellness diagnosis, all you have to do is write the labels such as readiness for enhanced health management, and then just put maybe diabetic care, whatever you're going to be working on. That's all you have to do for that. Okay, so we'll go through those. Okay, and so then the last thing I want to cover is diagnostic errors. And probably the biggest things that you will see when people are doing a nursing diagnosis is they use medical diagnoses in that. And that's a no-no in the nursing world. You want to use the pathophys. So instead of saying they have a appendectomy, say they're having acute pain related to, they just had surgery, they had an appendectomy, you would put that perhaps they had uh, interruption of tissue and muscles, or you would put the pathophys behind it. You wouldn't put they had an appendectomy. You're going to put actually the pathophys. Avoid using those medical terms. Okay, so that's a big one. Another thing is that you don't collect enough information at the beginning of the assessment, so then you didn't get the right diagnosis, or you didn't figure out the right reason why they have it and that. And so sometimes we need to ask for help or get additional help, and don't be afraid to ask for some. And so I have additional guidelines: identify a patient's response, not the medical diagnosis. Identify a patient's problem rather than a nursing intervention. Okay, so intervention is something that you're doing. It's a verb. A problem is something that occurs. Okay, avoid legally inadvisable statements such as blame, such as risk for falls related to caregiver not watching patient. Okay, that is a bad thing. I just put someone at blame. It's in a medical record. They could be sued. And you only identify one problem. You can have multiple diagnoses, which most people do, but you have to write one at a time. And then once you got your diagnoses, you're going to enter it in the plan of care, and we're going to start working on it and planning the next phase on what we should do about it.